Welcome back to Ventripoint Diagnostics channel, everybody. We're, of course, joined here once again by Dr. George Adams. We're going to discuss some more studies. But first off, George, how are you doing today?
I'm very well today. It's a bright, sunny day.
Perfect. Glad to hear it. So it's no secret that you guys have a lot of clinical studies planned and ongoing, and I hear you're ready to share some secrets on what's been happening with one of them. What's been going on, George?
Yes, well, we've been working with the pediatric and adult congenital heart disease group at Duke Medical Center for a number of years. And they've now initiated a study to look at single ventricle patients. So these are children and adults, ventricular and adults who have only one ventricle, don't have a left or a right, they just have, and the right, so the right ventricle is severely deformed. And so obviously these patients have to be monitored carefully as children and all for their whole life. And so we're very excited to work with Duke to show that the VMS is the perfect tool to monitor these patients.
Yeah, this sounds like a very specialized study. So is there any big names attached to this? Who's like running this program there?
Well, so the principal investigator is Dr. Barker at the Duke Children's Hospital. He's the chairman of the Pediatric Congenital Heart Disease Council, which is a national U.S. program to look at the best ways to deal with everybody, adults and children with CHD, not just single ventricles. So he's a national figure in terms of what's the best way to deal with these types of patients. And so we're overjoyed to have Dr. Barker being the principal investigator on the study.
And when it comes to your guys' inclusion in this, what are you really looking for? What are the markers, or like what can people expect to hear next?
This is an FDA registered study, so they're going to start, when they start enrollment, they have to keep updating the clinicaltrials.gov website on how they're doing. So there'll be, people who follow those kind of things will be able to get that information right up from the FDA website. And we'll go forward to see that, and I would expect, that the game here is for Duke to map out that the VMS should be the standard of care for monitoring children with congenital heart disease. We have other groups doing other studies in congenital heart disease, looking at right atrial, left atrium volumes, looking at various things as well, which will add to the database. But we really want to get to a point where we say, this is the way, using the VMS is the way to monitor these patients for their whole life. The American Society for Echocardiography, the American College of Cardiology, the European Society for Cardiology all have a guideline that say people with single ventricles should be scanned every 3 months, have an echo done on them every 3 months, because you can go from having, being fairly stable to being in a very bad situation in 3 months.
So it's a rather vulnerable population is what you're talking about here. And so these are people that require, as you said, somewhat constant monitoring, and the current system in place is rather burdensome for that, correct?
The current echocardiography does not do a very good job on right hearts, and these people all have problems with the right side of their heart, right? And so there's no point in doing an echocardiogram on a patient every 3 months using conventional techniques, because all you're going to do is look at the pictures and go, yep, I guess it looks the same as before. But what they need is quantitative analysis, which is what we do, and we'll be able to look at the numbers and see what the trend lines are every 3 months and say, oh, now we have this is different. We have a problem. We need to do something. So, yeah, that's the whole point of the VMS, is we're able to give accurate, reliable results and easily change from routine exams. So they will be able to meet the guidelines. They will be able to study these people, monitor these people every 3 months. And so there will be far fewer people who end up in a crisis and end up in the emergency ward and consuming, tens of thousands of dollars of healthcare dollars because they didn't get the proper screening done 3 months ago.
Wonderful. Well, George, this does sound like another exciting study. Look forward to hearing more. If anybody has any questions, don't be afraid to send them over. But George, do you have any last things to add before we go today?
No, I'm just happy that it's another major center in the United States taking on the product and showing that its value and use. So that's a big milestone for us.
Sure is. Well, George, thank you for joining, and thank you everyone for watching, and stay tuned for more coming soon. George, have a wonderful day.